exposure to these guys. Why are we prescribing extra? We're making certain that we're keeping our women sick. What are concerns regarding endocrine disruptors? This comes from the United States Environmental Protection Agency. Developmental malformations, interference with reproduction, increased cancer risk, and disturbances in the immune and nervous system function. And that's what I want to go over today, is if you're on birth control, I'm just gonna tell you right now, if you're so worried about the coronavirus, the birth control ain't doing you any favors, honey. You got to start to think about these things, okay? So there is growing interest in the possible health threat posed by endocrine disrupting chemicals, which are substances. You know, I think I've made my point, okay? This is the statement from the Endocrine Society, scientific statement that's supposed to be law. Okay, they are substances in our environment, food, and consumer products that interfere with hormone biosynthesis, metabolism, or action resulting in a deviation from normal homeostatic control or reproduction. In this first scientific statement of the Endocrine Society, we present the evidence that endocrine disruptors have effects on male and female reproduction, breast development and cancer, prostate cancer, neuroendocrinology, thyroid, metabolism and obesity, and cardiovascular endocrinology. Results from animal models, human clinical observations, and epidemiological studies converge to implicate that EDCs is a significant concern to public health. Are you really concerned, America? I really don't think you're concerned when over 65% of us are taking it, and by the time women hit menopause, the majority of women will have taken some form of birth control. Seriously, their own research says, don't do this. It's going to cause all of these problems, and all of these problems are killing us. And so what in your right mind thinks that you're doing anybody a favor by writing that script? It's absolutely insane, and sorry if I get emotional, but this is like, honestly, and this is gonna sound really crude, but I don't even care. I believe with 100% with all my heart, birth control keeps me in business. Amen. And that's ridiculous. If it wasn't for birth control, I probably would have 80% less people, because most of my people are hormone people. And there have been research studies over and over and over and over again showing that birth control causes Crohn's disease and irritable bowel syndrome. And so that's probably the second biggest population we see, are people with GI issues or different things like that. So without birth control, and you guys, I'm not saying this to brag, but I'm booked out a month. And most of these people are coming to me with hormonal issues, and it's tough to get into me. Because it's tough to get into any of these doctors at the Wellness Way, because we start to think differently. Unless these doctors are starting to look at this from a different perspective, we will always, always remain sick. Birth control affects our hormones, obviously. I talked about that at length. Our immune response, our mental health, our long-term health. So let's look at these in a little bit more in depth. I already showed you how birth control affects your hormones on a monthly basis. Now let's look at this long term. I found this study. Of course I could believe it, but I just was like, seriously. This is from the Journal of Human Reproduction. Oral, transdermal, and vaginal combined contraceptives induce an increase in markers of chronic inflammation and impair insulin sensitivity in young, healthy, normal weight women. A randomized study. You guys, I'm not here to tell you my opinion. I'm here to give you exactly what the research says, but nobody's telling you. Okay? When this says, just by the title alone, I read the article, insulin. Let's talk about that. Okay, so a lot of people don't realize, okay, birth control is going to impair insulin sensitivity. That's what the article said. Insulin, for me, my personal story, I was on birth control for years and years and years. I got off birth control. I was diagnosed with PCOS. PCOS and insulin sensitivity are really closely linked. PCOS is mostly a metabolic disorder. And so when I'm looking at insulin, what insulin does and how it affects your hormone regulation is, remember when I told you that your brain has to send signals to the ovary to start to create that hormone? Well, then the ovary sends signals back to the brain so it knows exactly what it should do. It's this big cycle, okay? What insulin does is it actually attaches to those receptors on the ovary. So the brain is trying to tell the ovary what to do, but it's not getting the message because insulin's in the way. It blocks that communication. And so a lot of times with women with PCOS, what do you notice? They have very irregular cycles. They can go months and months without a period. That's how it was for me. I would go maybe have 3 a year. When they came, they were awful. So instead of developing mature follicles, my body was developing cysts. And I truly, with all my heart, believe that I didn't have that problem before I started birth control. So if that was my problem now, okay, now I have to overcome insulin sensitivity if I want a chance at balancing my hormones and getting pregnant. So what did they do? They put me on metformin. Okay, so metformin, trying to fix that, all that metformin does is blocks the absorption of sugar in your GI tract. I didn't have a sugar problem, I had an insulin problem. They're two different things, okay? And so when it's saying that in healthy, normal weight women, what happens when you have insulin resistance? Your weight goes up. I'm still battling insulin resistance today. I get my insulin checked every few months, and I've made a ton of progress, but I have to be extremely intentional about my sugar intake and things like that in order to help balance my hormones. That's my story. I have to suffer the long-term health consequences from my decisions. And you might be in that boat too, where you have long-term health implications that now for the rest of your life, you're gonna have to fix the damage that was done. And so with insulin and then CRP. So CRP is an overall inflammatory marker. It's measuring inflammation throughout your entire body. And if you've been following us for any length of time, you are well aware that everything has a root cause of inflammation. So CRP is pretty darn important. In fact, the average CRP level before this study was done was 0.7. So you want your CRP level to be less than 1. So in normal, healthy, normal weight, healthy females, we expect them, to be less than 1. So the average was about 0.7 for these people. During the duration of the study, and now I'm blanking, I think it was 9 months that they did it. 9 months or 9 weeks? I will put it in the comments when I forget. I'm forgetting right now. But after the duration of the study, the average CRP went from 0.7 up to 5.4. It went over 5 times the inflammation within that woman's body during the length of that study. Anything over 3, a CRP over 3, is considered to be a high risk for cardiac event. What? Okay, so it's increasing it's impairing your insulin sensitivity. It's increasing your overall inflammation. And so now we're giving all these women hormone to fix them, quote unquote. And instead, we are leaving them with crazy amounts of inflammation, insulin sensitivity, which doesn't bode well for inflammation either. And then they get off the pill and wonder why they can't get pregnant. Ridiculous, okay? And our immune response. This is the part I was so excited to talk about today. In fact, it made me a little bit nervous because a lot of different people are concerned about coronavirus right now. And one thing that made me start to think differently was when I first started here as a nurse, we had an IV center at the time. That's where I was working in. And so while these IVs were dripping and I was washing the patients, I was doing research. And I came across a society called the American Society for Reproductive Immunology. And I went over to Patrick and I said, "Hey, have you ever heard of this society?" He's like, "No, but I love them already. I love the title of what they're trying to do, is seeing how the immune system affects reproduction." And so he did buy me amazing, and he's like, let's get you a ticket to go out and learn more. I'm like, ooh, well, thanks, big brother. And so I went out to a conference, and there I met some really fabulous scientists that are studying how the immune system affects reproduction. And that is the basis for almost everything that I do with infertility, and something that a lot of different people will never ever look at. And so I want to show you and prove to you from several different studies today how your hormones actually influences your immune system. And so if you're wondering, or your immune response, so if you're wondering, by the end of this, I'm hopeful that you're confident in picking the right answer for what might be for you. So here's one of those research articles: sex influences immune response to viruses. Haha, coronavirus. We don't know anything that much about coronavirus, but it's a virus. All viruses behave the same. Okay, viruses and efficacy of prophylaxis and treatment for viral diseases. So what this study showed was that just in general, setting outside the study, 75% of people that have autoimmune diseases are women. And that has to do with how the immune system actually works in relation to your sex hormones. I'm going to jump ahead for a second to this one graph. This graph right here changed the way that I viewed practice. And this comes from a different research article. It's called, it's this one right here, Sex Matters and Infectious Disease Pathogenesis. So what they found was that what happened was male versus female, because we all have the same hormones, right? But it's very evident that men have hormones that are more in abundance and women have hormones that are more in abundance. That's what makes us male and female, right? So what they found was that in men, typically because of their hormonal balance, they tend to have a weaker immune response. And so when they get very sick, or they have some sort of damage to their tissues because of a virus or something like that, it's because their immune system is actually weaker based on their hormonal patterns, okay? And so the man flu actually is a thing. So when people are saying, oh my goodness, like it takes them forever to recover and they're such a baby, well, yeah, they feel really sick because their immune response is lower. In fact, in different studies, they show that the CD3, CD4 cells in men tend to be lower than they are in females. When we're talking about CD4, CD8 just last week. Where in females, the difference is how they can get the worst response is because their hormones, especially the estrogen, testosterone converts into estrogen in the tissues. And so a lot of different types of medications like aromatase inhibitors and things like that actually work within the tissues. And so if you have an abundance of that estradiol in the tissues, a lot of it settles in the joints. So a lot of women will have increased immune response and autoimmunity in those joints. So they have a higher incidence of rheumatoid arthritis and lupus and things like that. And so with this female having the heightened immune response based on her hormones, then a lot of times women tend to fall in the camp of autoimmunity. Okay, and so what they're doing is they want to do a lot more studies on how these sex hormones influence that immune response, and they have a few that I want to share with you today. So going back, 75% of the people that have autoimmune diseases are women. Let me go back to here. And there have been multiple studies that have shown that birth control or oral contraceptive pills have been linked to viral and urinary tract infections. Because what are we doing? We're suppressing that man-made response of our estrogens to be protective for us. Okay, so we're suppressing that. So by having that, you are more linked to a viral and urinary tract infections. In fact, progesterone is an anti-inflammatory agent, which is why in pregnancy, your progesterone is the dominant hormone. Progesterone is there to be an anti-inflammatory hormone. So a lot of times people say, well, Nicole, if you're pregnant, is your immune system suppressed? Well, no, not really. Your immune system isn't suppressed. It's acting differently. It's a highly anti-inflammatory environment, because if it was acting at full speed, listen, guys, your immune system's job is to detect self from non-self, right? Well, a baby is non-self. Sperm is non-self, okay? So sometimes when women have an inability to conceive, it's because they have a heightened immune response within their uterus. The uterus has to be both a lion and a lamb. It has to be strong enough to ward off the bad guys, but gentle enough to not include the baby or the sperm. And so that's what kind of triggered this thought process among scientists. Is they're like, well, how come the body doesn't just reject a baby every single time? So the female hormones actually interplay with things called cytokines. We have uterine natural killer cells. We have different cytokines, Th1 and Th2, which are helper and suppressor cytokines. And so for those women that come and they say, Nicole, what am I supposed to do? I can get pregnant, that's no problem, but I have recurrent pregnancy loss, or I've gone through IVF 6 times and it hasn't been successful. Well, has anybody ever taken the time to look at your Th1, Th2 cytokines? Because if you're going through IVF, they're giving you all the hormone from the outside. So you don't have your hormones to protect that immune response anymore. And so knock on wood, so far, everyone that I've worked at, where we've looked at their Th1, Th2 cytokines and uterine natural killer cells, by decreasing inflammation, by starting to remove those triggers from their body, every single person that's then gone on and chosen to do IVF or different things like that have actually gotten pregnant, 100% of them. And I'm very proud to say that, because we are looking at things differently. Ladies, you are not broken. There is a beautiful balance between your hormones and your immune response. And when we're suppressing those hormones from the outside, it's going to alter that immune response. In fact, this study said, studies of both humans and rodents illustrate that the number of activity of innate immune cells, including monocytes, macrophages, and dendritic cells, as well as an inflammatory immune response in general, are higher in females than males. They have done studies upon studies upon studies saying that females have a more robust immune system because of these hormones. So why are we suppressing these hormones? And what does that do to our immune system in the long term? Now, at the same time, if women have an abundance of hormone, that can become problematic. If their body can't get this hormone out, and you can't support the liver, and you can't support, this inflammation and things like that, that is what can lead to a ton of extra hormone with a super heightened response, which can lead to autoimmunity. So you have to be careful. Having too much of a good thing, you can't have too much of a good thing either. You need to be in delicate balance, which we need to get back to that normal physiology. So here is in that study of that viral response. And so here we are. We have the days that this down here says days after virus exposure. Up here, the magnitude of the response. And you can see the pink is female and the blue is male. So you can see from the time that the female or male is exposed to that same virus, because of the receptors on our hormones, the females have a much higher antibody response producing cells than effector T cells. The virus elimination by the adaptive immune response because of CD4 T cells and CD8 T cells, and studies have shown that men have lower CD4 cells than CD8 cells. And so ultimately the body's going to fight it. And then what we're left with is females. They're kind of left with higher titers, and males have the risk of the virus continuing. In fact, because our hormones are there to protect us, if we are shutting off that response, we're blunting this. And because of the evidence that shows that how the hormones play a role in CD4 and CD8 cells, females are at a higher risk of contracting the virus if this response is blunted. But if it's not, actually, because men have a lower response, what's happening is that men are more likely to die from the virus. So I did a little Google search right before I got on here because I was going to say, mark my words, is that after this coronavirus has been blown over, there will be far more deaths among men than there are among women because of this unique response that we have to keep our immune systems heightened until pregnancy occurs. And I did a quick Google search, and sure enough, it says that the number of deaths from coronavirus, men far exceed women in the way that they are actually dying of the virus. And so women, trust your immune system. We were given this innately to really be able to help us. And what are we doing? But we're starting to blunt all of that so that our testosterone is the dominant hormone. Your estrogen and progesterones are suppressed, which means that you don't have that endogenous progesterone, which is your anti-inflammatory agent, right? I just showed you that's how progesterone works, is it calms down inflammation. So whenever you're having whenever you're taking something from the outside that is suppressing that response, it's not going to be a good day for you. Use your hormones to your advantage. So our immune response, it says progesterones can modulate the function of dendritic cells. And women's with a higher plasma P4 or of progesterone concentrations have a greater number of interferon alpha, okay, which is producing these dendritic spots in response to the HIV ligand, okay, than women with lower progesterone. So basically, it's saying that we can fight the HIV better by having these protections. Use of progesterone-based hormone contraceptives is also associated with increased acquisition of HIV. So using some of these progesterone birth control is associated with increased chances of getting HIV, of getting a virus that's going to destroy your immune system. Right? And actually there's been numerous studies. I put it down here. Oral contraceptives. So acquisition of HIV, loss of CD4 cells, which Dr. Flynn just went over that last week, the importance of making sure you have those CD4 helper cells. So these birth controls have a loss of CD4 cells, disease progression, and death rates among women. Why aren't they telling you this? Why aren't they telling you this? Oral contraceptive use is associated with increased genital tract shedding of HSV2, of herpes simplex. They say all the time, hey, your birth control does not protect you from sexually transmitted diseases, so make sure that you're also using a condom. And actually, I would argue that birth control is putting you at risk for those sexually transmitted diseases. So you have an increased chance of getting them if you're on the birth control pill because your immune response is blunted. You're not making those CD4 cells. You're blunting your anti-inflammatory response. You guys, it doesn't take a rocket science to start to figure some of this out. So again, I take you back to this page, and maybe I should have just put it earlier, but if we look at this, the hypothesized relationship between host damage and the host immune response following infection as presented in the context of damage response framework. When an immune response is weak, i.e. not sufficient to clear a pathogen, the damage caused by the infection is high. And when an immune response is too strong, quote unquote, excessive enough to cause tissue damage, the damage caused by infection can also be high. Based on the literature presented, we hypothesize that a male bias in disease risk may be observed when weak immune responses underlie high levels of host damage, and female bias in disease risk may be observed when strong immune response continue to host damage. Okay, so we're saying basically tissue damage can either be from too low or too high of an immune response. So if we're taking something from the outside that's altering our natural immunity to different things, the way our immune response works to fight viruses, we're putting ourselves at risk. And I just love this research, so I wanted to show you. There are differences between the sexes in the induction of genes associated with antiviral responses, with immune cells from females showing a 10-fold greater level of expression, antiviral expression, than cells from males. Studies of both humans and rodents illustrate that the number of activity of innate immune cells, as well as inflammatory immune responses, are higher in males than females. So generally, females exhibit greater antibody and cell-mediated immune response to antigenic stimulation, vaccination, and infection than do males. So females get greater antibodies because of these immune responses and vaccinations. So if you have a lot of extra hormone and your immune system is ramped up and you choose to go get a vaccine, your antibody production is going to skyrocket. And where does that extra thing settle? In those joints. Guys, we just talked about that that's where things settle when you have those tissues, which can put you at risk for rheumatoid arthritis, lupus, and the like. Clinical studies reveal that men have lower CD3 and CD4 T cell counts, CD4 to CD8 cell ratios, and Th1 responses than women. Females exhibit higher cytotoxic T cell activity, along with upregulated expression of antiviral and pro-inflammatory genes, many of which have estrogen response elements in their promoters. I've been saying it for a really long time, but I about spit out my drink when I was reading this last night. I said, it's my theory, I don't have any research to support this, but over 90% of the women that I see with endometriosis typically have a yeast overgrowth. So I'm like, I think that probably what's happening is this yeast overgrowth in the gut is blocking the liver's ability to clear hormone effectively, because the yeast just sitting there releases like hundreds of types of toxins, and unless we're intentional about clearing it, it can block the liver metabolism of hormone. And I said, I don't know why, but the majority of my endometriosis patients have yeast overgrowth within their gut. And right here, in this research article, when I saw this, I was just like, what? Sex steroids can alter the composition of commensal bacteria, the good bacteria in the gut, to cause sex-specific development of disease. The genome of the human papillomavirus, HPV, high-risk type 16 and 18 contains a progesterone response element. And I'm like, okay. So they're saying, okay, if we have antiviral capabilities, right, with these hormones, but if we blunt those hormones, now all of a sudden we don't have antiviral properties. And so keep that in mind as we continue to go on. But Candida albicans contains an estrogen-binding protein that has a high affinity for estradiol, which can stimulate the transition of the yeast into a hyphal form that may increase fungal virulence. It just says Candida albicans has a specific protein in it, yeast has a specific protein in it that binds to estradiol. What does the majority of endometriosis patients have? An abundance of estradiol. That chart that I showed you, if you have a normal amount of hormone and then you squash it, that's going to have you be normal. In endometriosis, the majority of my patients have an excess amount of estradiol. So now they're taking a synthetic form of estradiol on top of it. If it's not blunting their normal production of hormone enough, then what happens is now all of a sudden, they have too much in circulation, which is why some women will tell you if they're taking some type of birth control, that sometimes they feel like they go crazy, that they're super moody, that they have breast tenderness, that they feel like, oh my gosh, like birth control was horrible. I was a horrible person and I got acne and I couldn't take it. That's because before you started the hormone, you had too much. Now you're adding extra and expecting it to be fixed. And those poor ladies that get the depot shot are stuck with it for 3 months before your body even starts to clear that hormone from your system. At least with the pill, you can stop taking it and hope that your body clears it. But so our mental health, it affects our mental health. 85% of women report having PMS symptoms. As those hormones start to mount, they start to feel like they're going crazy. And so that's why when people have a lot of hormone before they get on the birth control, now they're putting it on top of it, they go absolutely insane. They're like, oh my gosh, birth control was terrible. It made me worse. And other people will say the opposite. They'll say, oh my gosh, I was crazy before birth control, and now I'm actually normal. I can function. Nicole, you do not want me off birth control because I'm a beast. Well, no, it's not the birth control's fault, whether you're high or you're low. It's whatever your hormones were before you even started. And birth control isn't gonna fix you. And so you have to make sure that you start to think about this. Birth control will either make that better or worse, which is why it's so hard to have studies to show birth control does this or birth control does that, because the hormones in which you entered birth control with are very different based on each person. So birth control finally affects our long-term health. These are the Cochrane is one of the best places you can go to, the Cochrane Library, where they do reviews, where they take hundreds and hundreds of studies and then they put all together the data and say, based on this meta-analysis of all these different studies, what have we found? And the Cochrane library showed the risk of heart attack and stroke in women using birth control pills. Since their induction, combined oral contraceptive pills have become one of the most popular birth control methods. When used correctly, the failure rate is less than 1 per 100 women per year. Despite their reliability, oral contraceptive pills have been found to increase the risk of blood clot forming in an artery, i.e. arterial thrombosis, heart attack, or stroke. Okay, ladies, put it in the comments. What is the #1 killer of women? Anyone know? Put it in the comments. The #1 killer of women is not breast cancer. Breast cancer is #2, but it's heart disease. Heart disease. And with over half of us taking birth control, I'm not naive enough to say causation always equals correlation or whatever, but I'm also not naive enough to think that there can't be some sort of connection. As arterial thrombosis is rare in young women, as many types of oral contraceptive pills, the size of the risk is unclear, okay? So they wanted to investigate this. So here's the results. Our results showed that the overall risk of arterial thrombosis was 1.6-fold. 1.6-fold increased in women using oral contraceptive pills compared with women who did not use oral contraceptive pills. The risk did not vary clearly according to progestin type. However, we found that the risk of arterial thrombosis seemed to be twice as high in women taking pills with higher doses of estrogen. Okay, so they said, okay, 1.6-fold. Did you hear that right? 160%. You are 160% more likely to have a cardiac event with birth control use. 160%. So I was like, okay, so we know this. I mean, I remember getting taught this in NP school. You got to watch out for blood clots, with birth control. And so I'm like, all right, let's check what the ACOG has to say about this, about safety of birth control, the American College of Obstetrics and Gynecology. Let's take a peek. This is right from their website. What are the possible risks of combined hormonal methods? Combined hormonal methods are safe for most women. Safe for most women, but they are associated with the small increased risk of deep vein thrombosis, heart attack, and stroke. The risk is higher in some women, including women older than 35 years who smoke more than 15 cigarettes a day who have multiple risk factors. There's a small increased risk. Why don't you tell us the truth, ACOG? 160%? That's small to you? A small risk of heart disease when your chances of getting heart disease go up 160%? I could maybe see if they said, oh, only about maybe 5% of women will get this, or, small percent. But if my chances go up 160% and you have the audacity on your website to say that it's safe for most women, only a small amount of them will have some sort of risk for a blood clot, I call out your bluff. That's not the case. And so what I did is, some people will say, okay, but actually birth control is actually going to decrease your chances for cancer. I've read this. Okay, so let's see what the truth is about that. So MD Anderson, the biggest cancer place in the world, taking the pill may help cut your risk of ovarian cancer and endometrial cancer, okay? So there have been a lot of studies that show that with birth control, because you're actually suppressing the endometrium and ovary for very, very long, there's no cellular proliferation, actually it decreases your chance of cancer. That's true, but that's what they capitalize on, okay? Ovarian cancer and endometrial cancer are extremely rare form of female cancers. What we need to be worried about more is breast cancer. Things like this. This is probably because the women who take the pill or ovulate release eggs from the ovaries, blah, blah, blah. The longer you take the pill, the greater the benefits. In fact, taking the pill for 5 years or longer may cut your ovarian cancer risk in half. So they are really saying, look at all this fabulous stuff that birth control will do to decrease your chance for cancer. The rarest forms of female cancer, mind you. And then they put this little itty bitty section right here. Breast and cervical cancer risks are higher, but just slightly. But just slightly, you have an increased chance of breast and cervical cancer. Have you been on the pill for several years? It may slightly raise your breast and cervical cancer risk, but this slight increase is only temporary. And then after about 5 years of you stopping the pill, then your risk goes down. Look at all this stuff they say look at how great birth control is for decreasing your risk, but I guess we have to tell you just one disclaimer, yeah, it might raise it just slightly for breast cancer. So breast cancer, this is from the National Cancer Institute. I wanted to see for myself. An analysis of data from more than 150,000 women who participate in 54 epidemiological studies show that overall, women who had ever used contraceptives had a slight 7% increase in the relative risk of breast cancer compared with women who have never used oral contraceptives. Women who were currently using oral contraceptives had a 24% increase in risk than that did not increase with the duration of use. Okay, so they say just a slight risk of breast cancer when it's 24% of the people that are currently taking birth control will get breast cancer. And then they say, oh, just a slight risk of blood clots, 160%. What is going on with their language? What is slight to these people? If 24% is slight, then 160% surely shouldn't be. They're not thinking the right way. Right? We have to change the thinking. So let's look from the National Cancer Institute again. Cervical cancer. Women who have used oral contraceptives for 5 or more years have a higher risk of cervical cancer than women who have never used oral contraceptives. But wait, how do we get cervical cancer? Oh, HPV. Oh, wait, what did we just prove to you is that women have an endogenous response to be able to fight viruses that's blunted by birth control. You take birth control, your chances for HIV and herpes are proven to go up, and we have to worry about cervical cancer because of HPV. Do you understand the craziness in this? If birth control increases your risk for viruses and HPV and herpes and HIV, and those are the things that are causing these cancers, shouldn't we be asking more if this is a good idea? One study found an increased 10% increased risk, okay, and a 60% increased risk with 5 to 9 years of use, and a doubling risk with 10 or more years of use. 60% more likely to get cervical cancer if you've been taking the pill for 5 to 9 years. But wait, MD Anderson just said take it for as long as possible because it'll decrease your chance of ovarian cancer. But if you take it as long as possible, it increases your risk for cervical cancer. You have to have one or the other, guys. Endometrial cancer. Women who've ever used oral contraceptives have a lower risk of endometrial cancer. It's reduced by 30%, okay? Lower for endometrial and ovarian, but cervical cancer and breast cancer have an increased risk, and you are much more likely to get one of those two cancers than these rare form of cancers. So why are we talking about this? MD Anderson, Beck, don't pick your birth control based on cancer risks alone. They say, don't lose sight of the bigger cancer risk factors. The pill isn't the only thing that puts you at risk for cancer, and it's certainly not the biggest. For instance, more cases of cervical cancers are caused by HPV than by taking the pill. You guys, we just talked about that. You're more likely to get cancer from a virus than you are from the pill, but they're not telling you that the pill makes you more susceptible to the virus. These are the connections you have to start to make. This is the craziness that is going on. And the people are just taking it and they're just believing it at face value because they're not looking into it further. Guys, we cannot cherry pick the positives and expect not to be found out. I'm calling out the American Cancer Society. I'm calling out MD Anderson. You guys, you're conflicting yourself. And I didn't use my opinion. I used your own data from your research. Are you kidding me? What are we doing to women? We're maiming them. That's what we're doing. We are taking away the very hormones that are meant to protect them. We are stealing their fertility. We are increasing their inflammation. We are starting to increase their insulin resistance, which is increasing your likelihood of diabetes. We're putting them at risk for heart disease. Is there a disease on the planet that isn't a big killer of women that we haven't already discussed today? All tied back to freaking birth control. It is insanity, and anybody that prescribes this should be thrown in jail. You're worried about medical tyranny because you can't get access to health care. I don't want access to that. Seriously. They're not doing you any favors, honey. There is no such thing as a cancer-causing hormone. It all comes down to the metabolism. And Dr. Flynn has spoken to this at length. At length. You don't get hormones, or you don't get cancer from your hormones. You get cancer from what your body does with them, how it can break it down, how it can clear them. This is a woman who is in menopause. She doesn't even have a lot of hormone. But if you look at her metabolism, how the body breaks it down, which you can only look at in the urine. So if you haven't had your hormones tested in the urine, I really encourage you to do so. You have these 3 different pathways. You'll notice the red pathway turns into a hormone called 4-hydroxyestrone. Just hanging out in your body, it doesn't cause any harm. It doesn't. But when a ton of hormone, in this woman, 35.3% of her hormone, what little hormone she has is turning into that one. If it gets to be in abundance, it can release what's called quinones, which can not detoxify, it can bind to and damage your DNA. These pathways are the pathways in which those hormones are broken down when you take birth control. You're putting yourself at risk. And you need to make sure that you're testing your hormones properly to see if what your hormones are doing is doing you any favors or if it's putting you at risk. That's true preventative healthcare. To be able to test this ahead of time, tell you exactly what your hormones are doing, and if you're at risk so that you can start to change your environment to be able to do that. So some FAQs I get all the time is, but what about a copper IUD, okay? Those don't have any hormones. You guys, it's still inflammatory. It's still something that it's still a foreign object in your body. I discourage its use. Diaphragm, cervical caps, you can't use them without some kind of spermicide, and that's something where the spermicides are very toxic to your system. You guys, if the birth control increases your chance for herpes and HIV, so you have to use a condom anyways, why don't you just use the freaking condom? It's not that difficult. In fact, you can get organic ones if you want. But what can I do for natural birth control? There's no such thing. There's no such thing, because your bodies were made to reproduce. You were made to have babies. And so anything that disrupts that process is not natural. And so, the best advice, but my child will for sure be having sex. Well, first of all, that's not true. I'm proof that you can wait until marriage and not blow up. But if you're thinking that your child's going, and then I encourage you to talk to them about their risk, about encouraging condom use, and then teaching them about their cycle. You really can only get pregnant during that fertile window. And so by teaching them, this is the time in which that you can get pregnant, and teaching them to recognize their signs for ovulation and things like that is gonna go a long way. We don't just need something just to cover it up and to make them sick long term. Let's teach our girls to learn about their hormones so that when they do want children someday, it's not going to be difficult. 1 in 4 women will go through a miscarriage, and 1 in 8 are struggling with fertility. In fact, more recent statistics suggest 1 in 6. That's way too many. Don't help your daughter to be one of them. So some suggestions: get tested. We already talked about this. The Dutch test is an amazing test, one of my favorite tests you can order to see how your body's metabolizing some of those hormones. Th1, Th2 cytokine ratios, that's something we can actually look at. So if you've suffered from infertility, or you're suffering from recurrent pregnancy loss, you can actually look at those cytokines within your uterus and see what your immune response is doing in there. Understanding your cycle, understanding that graph that I showed you earlier, knowing how it works and knowing when it's abnormal. Chase tree, fabulous. When we said that progesterone is an anti-inflammatory, chase tree really helps with your body's natural production of that progesterone, and it can actually really help with that anti-inflammatory thing. I don't suggest these things without getting tested, but know that there are herbs that you can take to help to support these processes. California poppy, that's a free-for-all. All women just need California poppy. When hormones cause a stress response, California poppy can be really helpful to calming that stress response, to making certain that your hormones aren't going crazy. Eating cruciferous vegetables. If you don't want to eat cruciferous vegetables, we have wellness greens in the store. Go ahead, buy a supplement, but eating cruciferous vegetables is really going to help to push some of those extra estrogens that may be going down, some of those pathways that we don't want to be going in abundance down towards a more protective pathway. So eating your cruciferous vegetables is super, super important in clearing of some of these hormones. How does your immune system influence your hormones? I just told you that there are different affinities for hormones within the tract of your GI system. And so maybe a stool test is in order. The majority of my endometriosis patients, we do find yeast or something like that going on that's affecting now their hormones and their immune response and their fertility. Reishi mushroom is another favorite of mine. It can help to increase those natural killer cells, especially important during pregnancy. And that's what Dr. Flynn had talked about a lot. So here are some practical suggestions of things that you can do to help your hormones. And there are clinics all over the country that are waiting to care for you. Even if this coronavirus shuts them down, we are still going to continue to be doing phone consults and being in your corner every step of the way. And there are Wellness Way clinics all throughout the country. And so I encourage you to go to thewellnessway.com and find a clinic near you. And you can find people who know this stuff extensively and have learned this stuff extensively to be able to help you figure out how to balance your hormones so that you can live your very best life. It's time that we need to stop listening and start learning so that we can think differently. Because obviously the people that are prescribing this stuff haven't connected the dots. And so it's time for us to be our own advocates and not just keep listening to what the doctors have to say, but to start learning and being an advocate for yourself. I hope you learned something today. Thank you so much for joining. If you learned something, please share this video, like it, because there's a lot of people that need to hear this. Thank you so much, and have a great day.